had what seems like a cold, but it hangs around for more than 10 days. It also comes with many nasal problems. It's a medical problem that is very common here in Louisiana called sinusitis. And with more on what causes this and how to treat it is Dr. Chad Domingue, a neurologist and pain management expert with the Avila Physician Network, to talk about this. Thank you so much for joining us.
Hey, good afternoon. Like many people in Louisiana, I've been living with this topic for the last 2 months. It's not a good time for sinusitis.
Yeah, it can be very painful. What exactly is it, and why is it so common in our state?
Yeah, so sinusitis by definition does not imply a cause. So by simple terms, it just means inflammation of the nasal passage. Pollutants, smog in our neck of the woods, allergies is obviously a big component. So what happens, why is it so bad here? We have these up and down weather, right? So the old quote, if you don't like the weather in Louisiana, give it a day, it'll change. So as that pressure changes, the pollutants in the air kind of get stirred up. And then as the barometric pressure changes, the airflow into our nasal passage changes and it increases mucus production. So even worse, on top of all that, with all the humidity that we have, the hair cells in our nasal passage called cilia cannot function properly. So all that mucus builds up and it leads to all the things that we all know very well with sinusitis.
Yeah, that makes a lot of sense. The back and forth weather does not help.
Back and forth.
So what are the symptoms people should look for to know that they may have this?
So the common stuff I think we're all familiar with: nasal pain, headaches, fever, cough, sore throat. What's really interesting, and I'm sure many of our viewers don't know this, you cannot always tell the difference between a viral infection versus a bacterial. So the common thing that we always say in medicine, if you have a fever, if you have a green discharge, or you're really sick, that points to bacteria, that is false. So you cannot determine viral bacteria based on symptoms alone. In general, viral usually improves after about 5 days, whereas the bacterial usually extends to 7 to 10 days. So it's really a time thing, not so much of a symptom thing. If you have really bad symptoms, you can do a CAT scan just to look for, inflammation or blockage. But the gold standard, if you really don't know, is to do a swab and obviously grow a culture to see what comes out.
So let's talk about treatments and what you need to be careful about.
Simple things like, right, Liz, we always talk about things that we can do to prevent things. Diet, don't think about that with sinusitis, but, there are foods that promote inflammation. Fried foods, red wine, all these things we're not supposed to eat. Things that reduce inflammation, green leafy vegetables, fish, those things are healthy. Hydration is a big thing, right? So as the humidity changes and all this pressure changes, that's a big component. One of the things that was interesting as I was doing research, we're all familiar with the Z-Pak. Who doesn't go to a doctor with sinusitis and get the steroid Z-Pak combination? So the American Academy of Allergy, Immunology, and Asthma, they came out with a study and they showed that 60 to 70% of patients that have sinusitis, they will resolve no matter what they do. But on top of that, 90% of American adults that go to a doctor get an antibiotic. So that means we're overprescribing antibiotics to well over half these patients. And I think this is such an interesting story in a world of COVID-19 where ivermectin, hydroxychloroquine are getting so much press. We're writing these antibiotics which can have a host of side effects. Other than that, things such as Afrin, these decongestants, but these guys are very dangerous. They can raise your blood pressure. If you have a thyroid problem, if you have diabetes, you have to watch it. And it's well written in the medical literature. You can become not physically addicted like we talk about with opioids, but your nasal patches can become addicted. So people that use this all the time, if they stop, they get like a overreaction, so they have to keep doing it. So it's really hard to come off of this stuff. Humidifiers, I got a big one here. Humidifiers are very good if you have cracked lips, dry, but you got to watch this stuff. They can harbor bacteria, fungus, things like that. So, as we always say, talk to your doctors, make sure what you're doing, why you're doing it, you know the risk and benefit of everything.
Okay, so some really good tips there, but the most important thing, because so many other things could be going on, whether it's allergies, the flu, the cold, or sinusitis, first you need to figure out what you're dealing with. So as you say, check with your doctor first before you take anything.
Yeah, absolutely. Know what you're shooting at before you shoot your gun. So it's very important that you understand why you're having this and the dangers of the treatments that you look at.
Yeah, otherwise you could be making things a lot worse. Thank you so much.
Absolutely.
Appreciate it.